want to make sure that you know a little bit about us and a little bit about what we're doing here at State Reform. You can see if you know us, and a lot of you do. I see as you guys start coming in the room here, I can. It's pretty interesting for me. I can just see like Rick McWhorter and Logan Jackson and Tara Richardson and Joel Ballou and Steve Love and Sonia Gaines and a lot of good folks getting in the room. If you know us, if you've been here before, you know that we think of our purpose as kind of social infrastructure in the reform conversation, that we are trying to be a bridge between the world of healthcare and the world of health policy. And that sometimes those two worlds would prefer maybe not to hang out with each other if they could avoid it, maybe not have conversations. And we think that whatever the conversations lead to, whatever the policy outcomes and the politics of the day are, that those outcomes require probably more conversations, not fewer. They require more engagement with one another and not less. And so we see our job as being one sort of straw on the camel's back, so to speak, trying to create spaces in the in-person space and then virtually where we can get together and build relationship, build that social capital that is required to, to make the magic of reform happen. And we do this in this in-person or virtual space. We do this in content, in part because of the kind of cultural underpinning of this movie, which, unless you're a 15-year-old, you were a 15-year-old guy in 1990, like I was, you may not remember this movie. But Memphis Belle was the story about some flyboys trying to complete their 25th sortie or mission over the European theater in 1944. And at one point during that movie, they say this prayer, which is actually not a prayer. It's a poem that they recite by Ireland's favored son, Yeats. And it's a poem titled The Second Coming, a reference, of course, a biblical reference, but it's actually about the failure of institutions to protect civility and society in the run-up to World War I. So the poem, Yeats's poem, is talking about how the leaders and the institutions of the day let down the people leading into the 1914 Great War. And in that poem, he says, "Turning and turning in the widening gyre, the falcon cannot hear the falconer. Things fall apart, the center cannot hold. Mere anarchy is loosed upon the world, the blood-dimmed tide is loosed, and everywhere the ceremony of innocence is drowned. The best lack all conviction, while the worst are full of passionate intensity." And his critique, of course, of 1914 was not nation-specific. It was not partisan. It was that our institutions of the day let us down. And so our role here at State Reform is not to be partisan. We're entirely nonpartisan and policy agnostic. We, however, want to lift up those voices that are taking those risks, taking the most sort of courageous steps forward to try to reform situations or the situations we find ourselves here in America, and particularly in Texas when it comes to healthcare and health reform. Sometimes the loudest voices are not always those with the greatest level of conviction, whether you are on the right or on the left. And so finding space for the quieter voices, the ones who are busy doing the work of reform, that is the area we try to focus on. And of course, we do that in the in-person space, but we do that also here virtually and via content. And one of the reasons we try to do this is we think that after having watched politics for a few decades now, one thing I think I know is that things always move more slowly in government than they should, right up until the point at which they move more quickly than they should. And when they move more quickly than they should is when things often get broken. So it does feel like we're in a time of moving pretty quickly. And we think of our content, we think of the work that we do at our site as informed by another movie, not a 1990 movie, but a 2004, 2005 movie called Super Size Me. That movie helped galvanize and catalyze the slow food movement, the idea that over slow food, you can build relationship, you can build community and conversation, and that those are the things that actually drive better health. The fast food is, of course, not healthy for the body. And we think of that as a metaphor for our news today, that we think that fast food makes the body ill in the same way that fast news makes the body politic ill. So our content at State of Reform is slower. It's not driven by impressions. We're not trying to generate a bunch of clicks. We just want to make sure that we are creating constructive stories and incremental conversations that help drive the kinds of discussions that will lead to better outcomes, regardless of those outcomes in a given community. So when we think about our content, we're now approaching 3,000 stories here later by the end of this year. We're on pace for that number, and that's a lot of content at our site covering Texas and, of course, a number of other states. So to be able to do this requires 4 different kinds of investment. To be able to create this kind of safe table at State of Reform where we get every credible voice in the mix. And one of those, of course, is our sponsors. And those folks help us to underwrite the cost, whether in person or digital. And we have had, really no better sponsor than AmeriGroup. They've been top of class in every way, and really are putting wind in our sails for the sake of having these safe tables and these conversations. They've been helping drive this conversation, help support our reporting in Texas, and hearing their guidance. If you're in the room with us, they'd say, hey, just keep doing what you're doing, create more conversations, because again, the more conversations we have, the better. Even if sometimes that leads to tedium and we sort of are tired of having another meeting, you can stakeholder things to death, but you kill them with kindness, so to speak. Likewise, we have major sponsors who are top of class nationally and in Texas. Health Management Associates, of which we are now a part. As of last week, we announced that we've now become part of HMA, one of the really great partner, and Hall Render, one of the best law firms in the country. It's the largest law firm devoted entirely to healthcare, based out of Indiana, but with offices, of course, in Dallas-Fort Worth. Sellers Dorsey, great consultancy with folks who understand Texas Medicaid as well as anyone. Texas Health Resources has been on the front lines of pandemics well before it was cool. Even back in the Ebola days, and the folks there, Joel and his team, are continue to help us drive conversations in Austin and in Dallas-Fort Worth as well. And then last but not least, Beacon Health Options, which is a managed behavioral health care organization that's working in places like schools and working in places like county government and with managed care organizations to make sure that mental health services are available and accessible when we need them most. And these days, we could all use more mental health support, I think. So when you look at these sponsors, this is really a good group of folks, some deeply embedded locally, some more national in nature, and we're just super honored to have them stand with us. The second area we have to have engagement in order to be able to pull this off is our convening panel. And our convening panel is a group of folks who help us identify the right topics. They help us identify the right sessions and speakers. And, these are folks who help us really make sure that the conversations we're having are the right ones. Maybe not the loudest, but the most constructive ones. Speakers is the third area. And of course, if you're going to have a stakeholder-led enterprise, if you're going to have a conversation with folks speaking from across the spectrum of care, then you have to have speakers join us. And we've got almost 56 of them here today to offer their 2 cents, to offer their thought leadership, their sincere and organic observations about the state of play in Texas healthcare today. And we're just super honored to have them. And then, like I said, almost 250. I say almost 250 because yesterday when we finished, we had 223. And when I finished these slides, we've already had 20 walk-ups, metaphorical walk-ups this morning. So up to about 243 so far this morning. So thank you. Whether you're a sponsor, a speaker, an attendee, or a convening panel member, I really appreciate your support and engagement. All right. Without further ado, I want to introduce our morning keynote speaker. Cecile Young is the commissioner at the Health and Human Services Commission. Of course, the agency is Texas's largest agency. I believe it's also actually the largest state agency in the United States with responsibility across a wide range of health services. And she's a busy person. So we're super honored and excited that you're with us here, Cecile, Commissioner, I should say. So Commissioner, let me just give you the floor. Take her away.
As we continue working towards approval of our state-directed payment programs, Clearly, the pandemic is stressing our healthcare system, both in demand and in dollars. But before I get into that, let me pause here to say thank you to all of you who are stepping up every day. Hospitals, doctors, nurses, health plans, everyone who is taking care of Texans at a time we are all adjusting and adapting to the ever-changing landscape of COVID. I also want to acknowledge the incredible work and commitment of our team here at HHSC. I know you're going to hear from some of our executives in just a little bit. In addition to those executives, we continue to do an incredible job for Texans under extraordinarily difficult circumstances. For example, we've completed more than 10,000 inspections focusing on infection control practices, incidents, or complaints related to COVID statewide. We've issued emergency rules and published guidance letters and sent more than 1,000 provider alerts to ensure providers have the flexibility they need responding to COVID. Our 211 call centers activated an option for COVID-19 information, handling nearly 820,000 COVID calls during the pandemic. Our team helped set up a statewide mental health line for Texans who need support day or night during the pandemic. So far, it's received nearly 18,000 calls. And during COVID, we've greatly expanded the use of telehealth, going from about 18,000 Medicaid client calls per month pre-pandemic to 317,000 Medicaid client calls per month in January of 2021. We're big fans of telehealth here. So, as I hope you can see, we stand shoulder to shoulder with you in the fight against COVID, sharing together in the challenges and solutions to protect Texans. That's why the pandemic looms over virtually every decision we make. We've got to ensure that we all have the resources we need for Texas to meet today's challenges and tomorrow's uncertainties. Unfortunately, a lot remains uncertain for Texas, most urgently and importantly, funding for our state's healthcare safety net. Since my return to HHSC last year, we've been working tirelessly to secure the next decade of Medicaid funding for our state by seeking an extension of our 1115 demonstration waiver. After receiving approval in January, we immediately began working to implement the provisions of the waiver, including meeting with stakeholders, adopting rules, setting rates, and submitting requirement documents to CMS well in advance of their suggested timelines. At stake right now is about $7 billion per year in our state-directed payment programs for Texas that were accounted for in the approved waiver. These dollars are for you, the providers, the hospitals, the health plans, and healthcare professionals. And most importantly, the patients, those Texans who rely on healthcare they receive through this funding every day. That's why it was so surprising when in April, CMS unexpectedly and without warning rescinded its approval of our waiver extension, just 3 months after approving it in January of this year. I must point out the timing of CMS's decision has consequences for providers, our healthcare system, and ultimately the many Texans who rely on Medicaid benefits to receive care. It's been more than a month since the federal court reinstated the January waiver. However, CMS has yet to approve the provisions of the waiver. Their approval is necessary to continue billions of dollars that support our healthcare safety net, not just this year, but for the next decade. Most notably, effective September 1st, without approval of these state-directed payment programs designed in the waiver, providers have seen a reduction in rates. And I'd remind you, these programs were created so we could meet CMS's own mandate that Texas transition out of district. I know the financial strain this is putting on many providers in Texas. All of this comes at a time when Medicaid caseloads remain high with continuous coverage and with COVID. That's why HHSC proposed to accept CMS's offers to extend district for up to 1 year, as well as the Quality Incentive Payment Program, known as QIP, and the Uniform Hospital Rate Increase Program, known as URIP. This allows us to access approximately $7 billion as a stopgap as we continue ongoing discussions for the state-directed payment programs that are in the approved 1115 waiver. While we're still waiting on CMS, we understand the loss of Europe funds represent a hardship on providers. And I hope everyone here understands that we recognize the urgency of the situation as we work quickly as possible to reach a final agreement with CMS on Europe. However, as I said, these are only stopgaps. They keep us moving in the right direction. They help us in securing some budget neutrality, but long-term sustainability for our healthcare safety net, assured to Texas under the approved 1115 waiver, can only be achieved through the pending state-directed payment programs. I have to emphasize, from the moment we received CMS's surprise letter in April that they were rescinding approval of our waiver, we went into high gear looking for solutions, and we have been and remain fully prepared to work with CMS. I would also note that we're being very transparent and open through this process, both with CMS and with all of you, to ensure everyone is operating with a full understanding of the facts. If you haven't already, I'd really encourage you to review our correspondence with CMS over the past 2 months. We posted it on our website to keep everyone informed of our efforts and our position. So here we are today, continuing to meet with CMS every 2 days. I want to repeat again that we are working with them every 2 days in an effort to craft a long-term solution that they will accept. And that provides what we've been seeking since our original application last year, which is financial certainty and sustainability for our safety net in Texas. Of course, made all the more critical, again, because of the ongoing pandemic. It's my hope that we resolve this sooner rather than later. I have no doubt many of you want the same. And if so, I would urge you to contact CMS and let them know the strain this is putting on each of your organizations. They need to hear directly from you. As we shared with CMS in our letter accepting their offers for a temporary solution and charting the path forward to long-term stability, we expect their final approval of the pending state-directed programs as outlined in the waivers, terms, and conditions can be achieved. This will ensure sustainability in the Texas Medicaid Managed Care Program through the next decade. There's simply too much at stake for too many to wait too much longer. And thank you. Thanks, Deidre, and thank all of you.
You bet. Thank you, Commissioner. So let me maybe just ask, I want to talk about ARPA funds and boy, telehealth is the sort of story of the pandemic, but on this meeting with CMS every 2 days, that's a pretty, as you've said, that's a very intensive level of engagement. How would you sort of characterize this point in your career in terms of like the complexity of working with CMS and federal partners versus other periods in your career where maybe you weren't, leading the agency per se, but we're certainly still dealing with federal partners. Are things more like polarized also in this kind of space? Is it more difficult to find common ground? How would you characterize this period of federal partnership engagement versus other periods in your career?
I would say that right now we are facing a lot of difficulty in working with CMS. I would like to assume good faith on their part. It is important for people who work together in joint programs like Medicaid to work in good faith. And again, I think Medicaid is a very complex program that has a lot of different wrinkles, a lot of details. I think one of the things you could see from looking at our website is that the questions are very detailed. So something that sounds very simple, like, for example, the kind of stopgap measure that CMS originally proposed to us and that we accepted in a September 7th correspondence with them. There are a lot of details that have to be worked out. And even in their offer, they don't exactly want the program that was in place, for example, with QIP or with Europe, They want us to be tweaking things, and those are very complex conversations and very detailed. So I think there's a level of complexity when you start getting into how these things play out. But I would hope and that CMS would be acting with us in good faith. We are acting in good faith with them. And again, we are trying to be very transparent. We've answered all of their questions throughout this time, and we posted them so people can see them. So I would encourage anyone to take a look.
Yeah.
But it's difficult. It's very difficult.
I mentioned, and we sort of talk is around ARPA funds, American Rescue Plan Act, which contributed quite a number of billions of dollars to states across the country. What are your thoughts on how Texas ought to be spending some of those ARPA funds and how they can be allocated towards either operational or more infrastructure investments?
So those, of course, are our legislative and governor's office decisions. There's an enormous amount of money involved. I know that they are meeting. I would say that we can, of course, use those funds. The legislature and the governor are having to work through whatever guidance that the feds have had. And so in whatever they're reviewing, they're having to make sure that Texas is following the rules on those funds. I will say we've already received some funds, not from that $16 billion pot, but there have been critical funding that has come to us through the Substance Use Prevention Block Grant, the Mental Health Block Grant. There's been some CARES funding for COVID relief that have paid for various things. We've had some increase in WIC and pandemic EBT and more. So, we've actually received a lot of dollars that can go to some of the critical needs that we've seen. And that has helped us pay for some of the things I mentioned earlier, like hotlines and those sorts of things.
Let me ask about telehealth, and within the scope of multiple years of work, much of which precedes your time in your current position. But back in 2017, there was a big session around telehealth. 2019 had a lot of action around telehealth legislation. We had Hurricane Harvey that upended the whole nature of healthcare delivery from licensing to care provisioning. And then we've had this pandemic. How is the commission thinking about sort of the movement towards greater use of telehealth? What does the future look like, given that we've put so much time in, Texas has put so much time in the last 4 or 5 years in trying to get telehealth up to where it is today?
I think, as I said earlier, we at HHSC are big fans of telehealth. It's very important. House Bill 4 passed this last time that gives us some increased flexibility on telehealth. We've seen during this pandemic how this has played out for us. As I mentioned earlier, we went from about 18,000 Medicaid telehealth to about 317,000, which is about 175% growth. It's very important. It's very helpful for us in areas of the state that don't have access to certain specialty providers and others. So we see this as a great opportunity to expand the reach of the providers for our clients. And so we're very grateful that we've been able to have this tool during this time. I will say, just from a personal perspective, I had an appointment that got canceled fairly early on in the pandemic, and had a great conversation with my doctor in telehealth. So I have used it in my own life and found it really helpful. So we see it as a great system change for us.
Adrian, going back to the 1115 waiver here for a second, Adrian Trigg, one of our attendees, asked the question about how attendees here today can help advocate to CMS about the 1115 waiver. I'll add to that. Are there particular things that you want attendees to give voice to that would help in some of your negotiations?
I think so. I will say that there seems to be a lack of understanding at the federal level about what Texas is like, how big it is, how far-reaching it is. We are not a small state, and we have vast swaths of the state that have challenges. A large portion of our Medicaid funding happens not just through public hospitals, but through private hospitals as well. And there seems to be a lack of real understanding, and this is my take on it, real understanding about how complex Texas is. And so I think understanding y'all's situation. So as you see the strain that this funding, this is the thing that I have said repeatedly. This funding is vital for the infrastructure of the state of Texas. It allows us to have adequate provider networks in Medicaid, but it is just, it's vital for us. And it's urgent. It isn't something that we can sit around and wait for 6 more months before this funding gets out. And so anything you all can do to convey to CMS that this is a real thing. These are not fake dollars. They are real dollars that serve real clients and support the infrastructure of the state. And that emphasis would be really helpful, I think. We use non-federal share for these state-directed payment programs. There seems to be some confusion on the part of CMS about those. We have talked repeatedly to them about those. They fund the programs that CMS offered as our stopgap. Those same funding mechanisms fund those programs. And I would just add, those are the same kind of funding mechanisms that other states use. One thing that was interesting to me about the 1115 waiver is, as we were trying to contemplate what we were going to do to maintain the same level of funding to the states, so that we wouldn't see a cliff, was that we tried to look at things that other states were doing. We didn't do anything that unusual. These are things that are very similar to what other things states do for these same kinds of programs. And so I know you can probably hear some frustration in my voice, but it's because I care passionately about this, and I am. So anyway.
Yeah.
Don't want to rant.
No, that's okay. Ranting's just fine. It's early, you get a rant all you want. Let me ask about sort of just stepping back from the specifics and the niche kind of granular 1115 conversation to this kind of broader conversation about purchasing based on value-based care purchasing, or in arrangements in these sort of regional kind of non-traditional payment models like those funded by DSRIP. But what are your thoughts on the state of value-based care purchasing in Texas Medicaid? It seems like it's sort of 2 steps forward, 1 step back sometimes. Give us your sense of where that sort of progress or that conversation is unfolding.
Well, and I think Stephanie may address some of this more when you all talk to her later, so I don't want to steal anything from what she might mention, but I would say that we have worked for a number of years to bring value-based payment models to the Medicaid program. And it's very important from the perspective of, we want to make sure that we're not just pushing out healthcare just generally. We really do want it to be something that provides good outcomes for our clients. And we do it in a number of different ways. There are, several key metrics that we look at, things like healthcare quality, member access to care. That one of the things that I mentioned earlier about the 1115 is that we believe it continues to give us um, places where our clients can go. So it gives us an adequate network. So member access to care is very important, and appropriate use of services, and of course cost. So we feel like we are getting, we have started down this road many years ago. We are getting more mature. One of the things that we did starting, I think it was last year or the year before, is the enrollment. So it's value-based improvements that drive our clients. So if we have an MCO, for example, that is giving value-based care, we are ensuring that more enrollment goes to that provider. That is good for our clients. So, and I
Good.
think, as I said, Stephanie may speak more to this later, but
I know we're running low on time. You've been very gracious in terms of carving out time to be with us. I appreciate it. Let me ask this last question. Obviously, you're leading an organization. Many of the folks in our audience are leading organizations. Give us just a sense of some of your kind of leadership philosophy during this extraordinarily hard time of COVID. Continues to be hard. What counsel would you give to leaders of healthcare organizations as they try to continue to navigate this pandemic?
well, I think this is true for any kind of leadership that you have, not whether it's the pandemic, something as big as the 1115 waiver and all the other things that we do, is to understand what it is your mission is. I will say that really helps with you making the decisions that you need to make. If you look at your mission, you think, does this help us fulfill our mission? That is a way that you can help prioritize the things that you need to do. And prioritization is something that you've got to do. You just have to. Some of these jobs can be very crushing. I think you know that these types of jobs are difficult. So being able to be flexible, because as you know, change happens, and it happens, as you mentioned earlier, it sometimes happens very quickly. I think there's a Ferris Bueller quote in there somewhere, but you have to be flexible, and you have to, again, keep in mind your mission. That helps you to do the things that you need to do. So.
Any morning where you can reference Ferris Bueller and Yates together is a good morning.
Amen.
So, Commissioner Cecile Young, thank you very much for making time to be with us. You've got a seat anytime we have one of these conversations, regardless of the capacity in which you serve. So thank you, Commissioner, for being with us. I appreciate it.
Okay, bye-bye.
Very good. Okay. I want to give you a little guidance in terms of next steps for the rest of our conference here today. Of course, I mentioned Senator Hancock and Representative Howard will be here for our afternoon keynote. That'll be a great conversation. Make sure you join. I mean, that's the kind of thing that's both, it'll be political because of the nature of those elected officials, but it'll also be very deeply informed in terms of healthcare and health policy. Throughout the day, of course, we've got the sessions, which you can find on our agenda page. You can jump in and out of those sessions very easily, just like you would walk from one room or another at the convention center. We'll be at Irving next year, I hope. Good Lord, and planning on Austin in February. On the left of your screen here, you'll see the About, and there's a little Sessions tab there, and you can click on that tab and see all of the agenda sessions ready for you, so you can bounce in and out of those throughout the day. Just here, you don't have to go back to the agenda page. Of course, our sponsors, you should visit those. It's a little bit of a virtual exhibit hall, but they've all got different content and different materials there for you. So just like you would sort of walk by the swag and maybe pick up some M&Ms or breath mints or whatever might be out there, I'd encourage you to bounce into those sponsor booths, see what kind of material they're putting out. In many cases, those sponsors are putting out the material that they think is highest value. So I think it's really worth a little bit of time. And finally, there's of course a help tab at the top. And if you send us an email, which is just help@stateofreform.com, that'll go to 6 or 7 of us, and we're all paying attention. We'll make sure we take care of you as quickly as we can. So Thanks for doing this. Thanks for putting wind in our sails. We'll see you throughout the day. And of course, I'll be back here for our afternoon keynote to end the day. Thanks, everyone.